So he says that the problem is that nurse practitioners don't have the authority to change anybody's lifestyle. And I take issue with that only because I don't think the significant difference is the label of a nurse practitioner versus an MD. He says that it's attributed to the mystique of an MD, the ability to change somebody's lifestyle simply by mentioning it. And, it's true that MDs tend to carry more weight when they say you need to stop smoking versus when a nurse practitioner says it. However, what's different, though, I think what the important categorization is, what is the condition that is involved? And just like I expect nurse practitioners to deliver equally effective care when you're talking about rules-based conditions like a strep throat, like an ear infection, and like a vaccination or a blood pressure check. When it comes to lifestyle changes, if it's so well understood and rules-based, I don't think you need that mystique or the intuition, as we call it, of an MD to convince somebody to change their lifestyle. And let me give you a more specific example. A lot of it has to do with how immediate the benefits are to the patient when they change their lifestyle and how recognizable and how much control they have over these effects. So a nurse practitioner could tell you, look, these glasses are going to fix your vision, and I know it's a hassle that you have to put on glasses every time, but it will work. That doesn't require an MD to convince you have to wear glasses because you can detect right away that those glasses help you, and yet it does require a lifestyle change. Whereas if a nurse tells you to lose weight because it's going to help your health in the long run, it might prevent a heart attack, that's a lot harder to take into account because the effects aren't immediate. You may not even feel the impact 20, 40 years down the line. But change it around, and let's say the nurse gives you a diagnostic test, and this test tells you that there is an 80% certainty that you will have a heart attack in 20 years unless you lose X number of pounds. Armed with that information, just like a nurse might be armed with a strep test result, I think it's a lot easier to convince the lifestyle changes that we're looking for.